Advancing Peace, Sustainability and Global Governance. As the Director of UNESCO Mahatma Gandhi Institute of Education and Peace and Sustainable Development, MGIEP, short that is known. He leads global initiatives promoting education, innovation, and sustainable development with a special focus on global south. Professor Aginam's academic career includes a tenured professorship of law and legal studies at Carleton University, Ottawa, and Global Security and Cooperation Fellowship of the Social Science Research Council (SSRC) of New York. Respected vice in global health diplomacy and governance, Professor Aginam played a key role in revising WHO's international health regulations. His distinguished career includes senior positions within the United Nations system, serving at the United Nations University in Tokyo and Kuala Lumpur. In his current role as Director of UNESCO MGIEP, Professor Aginam is focused on strengthening the role of education to meet the Sustainable Development Goals (SDGs). He champions innovative approaches to education that emphasize peace, sustainability, and global citizenship, working to transform learning systems to better prepare future generations for the challenges of our interconnected world. He is also the author of Global Health Governance, International Law and Public Health in a Divided World and other publications. And with this, I would like to give very uh, which I can call like important information. I have introduced a few of papers here in this IS, titled as Global Diplomacy and Global Health Governance. Both of the papers I have designed, of course, because of the mentorship of Obi, because I have worked with Obi for more than 2 years, did that and my association with Obi. Actually, I have learned and I have learned how to basically public health should be associated with the concept of international relations. So with these words, I welcome Professor Obi Aginam. And yeah, of course, yes, of course, I have got published a book. The title of the book is Intersecting Realities of Health Resilience in Governance in India. Again, the source of motivation for getting this book published is Obi. So all the credit goes to Obi for this. The entire, the whole achievement of mine. With this, I am going to present my book.
Thank you, Shantesh. Today we have Professor Sharad Soni, who is the Dean of the school for today. He's acting as officiating. And I will request Professor Soni to welcome our guest today with a token of our appreciation and, of course, take over. I request you to preside after that. Oh, you should show that.
My first because if there was one thing that COVID-19, it was just infectious diseases. So it raises questions about at the level of scholarship, okay, scholars of international relations. So what do we do about this in terms of how do we actually, reconstruct our notion of security to bring back, human security to, think about, say, something like public health from a security perspective. How do we securitize, in public health? Now, when something happens, let's talk about, say, something like Ebola. Okay, something happens in a tiny African country of Sierra Leone, or Democratic Republic of Congo, or Guinea, or Liberia. Those are the epicenters of Ebola. There's a sense in which populations in North America or Europe, or even Asia, okay, or if you live in India, you see it in the news. There's an outbreak somewhere, because you see it on CNN and the global media, you hear about it. But there's a sense in which you tend to think, oh, this is a problem in Sierra Leone. It's a problem in the Democratic Republic of Congo. Okay? I'm in India myself. And that thing can also gets into the minds of the policy makers who make policies, defense policies, for instance, or who are in the ministries of external affairs, who are supposed to, drive the foreign. Okay? So the problem is that immediately that virus or that pathogen escapes, quote unquote, from Liberia, from Sierra Leone, from DR Congo, through travel, and there's a single case of Ebola in the US, okay, that mindset changes. It's no longer a tiny problem, health problem affecting a local population. It becomes, a threat to the populations in the US. And that notion, among state officials, whether it's foreign policy officials or defense officials, it changes. So at what point do we categorize a health, an outbreak, for instance, as a security issue? And I raised this question because I'm going to come back to them to my ideas towards the end. Again, Zinsa, in this very interesting book, which was written quite decades ago, but some of the ideas still resonate with all of this, that is contemporary issues. And the effects of a succession of epidemics upon a state are not measurable in mortalities alone. Because sometimes we look at this and say, okay, well, Ebola killed 50,000 in Sierra Leone, or 1 million in Africa. COVID killed, those kind of, so it's not just the mortalities. We can count the numbers and come up with those figures. But I find his argument very persuasive when he says that the secondary consequences have been much more far-reaching and disorganizing than anything that could have resulted from the mere numerical reduction of the population. So yes, the world lost millions of people during COVID, but there were some places that it hit countries, hit so many sectors, aviation, industrial, the different sectors, for instance. Okay, so again, the shift in mindset is necessary, not just thinking about the numerical, reduction of the population. Now, COVID, I didn't want to get into depth about COVID because it's still fresh in our minds, and then in the interest of time, because I want to get back to this, these ways of the stigmatizing public health. But there's one argument again, which supports this as argument that we were talking about the SDGs, Sustainable Development Goals, and countries were making progress. It's now 4 years to 2030. So there were very good progress made in so many countries on reduction on education, for instance, goal 4, on gender, and all of these things. The 17 goals, that's the package, the Sustainable Development Goals. But what the pandemic did, what COVID did, was to actually derail this. Okay, some of those progress that were made on reduction of poverty, access to education, hunger, and those important goals. So 2 decades of progress in reducing extreme poverty have been pushed into sharp reverse in so many countries because of the impact of the virus. Okay? So now in so many countries, the developing countries, that's now they dealt with COVID-19 at that time. That was the growing climate emergency, which is another threat before us, and the increasing debt burdens of these countries. Okay, so you can see how just a health issue basically reverses progress that was made on sustainable development. And I do know that there's some of the scholars in the room who are called scholars of international relations and international studies. So I want to talk about, in the context of some of the issues I've raised, the international system that we live in. I started with Australia, so let me expand on that a bit, and then we can chart the way forward. So we've known that the international system is state-centric. Okay, what happens at the United Nations is just a coalition of states. No matter how well-intentioned you are, as a non-state actor, You can be seen, but you can be heard officially, okay, in some of these multilateral forums. So, so that is the governments all over the world, get together as members of the UN or WHO or UNESCO, all of these organizations, to transact business, amongst themselves. But there's also the multicentric system that is arising, that is now gained some traction in the international system, and this is some form of coalition. It's not a formal coalition, but there's interaction going on between states, between nation states, and non-state actors. This could be civil society organizations, this could be philanthropic foundations, Bill and Melinda Gates Foundation. There's quite a number of them. And also what some scholars have called, celebrity diplomats. Yeah? There are individuals who can actually influence, policy at the international level, and we know them. Yeah? So this is some form of, interaction between states and non-state actors. They can compete. It doesn't mean that the interests of all these actors they go in the same direction. If you're talking about health issues and you want to build public-private partnerships, for instance, you bring Pfizer to the table. Pfizer is a transnational profit-oriented company. Okay? Yes, they make medicines and health products that will help humanity, but the CEO of Pfizer is not driven. The most important motivation is the shareholders. Okay? Profit. So when you bring all of these actors to the table, they may compete, they may cooperate somehow, and they interact in very formal and informal ways. So that has complicated governance. This kind of interaction. There are some celebrity diplomats. There are some private entities, philanthropic foundations, that are much more powerful than developing countries at the international level. Okay? They have more money, they have more access to important people that make decisions. So that's the international system we live in. Okay? So there is some, I wouldn't say there's a shift, from the state system. It's there, it's solid, the Australian system is there from 1648, but it adapts somehow. And this adaptation is not formal, it's not rigid, it's not a formalized adaptation, but it has to interact with all these different actors out there. So this complicates governance, okay, in different ways. Governance through the state-centric system is still very well known to us. International treaties and agreements and all of this within and outside the UN system, for instance. These are the various ways that nation states do business. Okay? But governance via this multi-centric system is something that is much more complicated. Okay? And scholars of international relations, or international studies, we have to study this more. Okay? There's quite a lot of scholarship on that. But some people call it public-private partnerships in the international system. Some call it global governance, strictly called, where you've moved away from the nation state to focus on these other actors. So there's now evolving a new diplomacy. Okay? And this is where the work of people like Shantesh becomes extremely important. So what we call global health diplomacy today has shifted from the traditional diplomacy of states. Okay, what states do on health issues, whether bilaterally amongst between two states, or multilaterally as members of, say, the World Health Organization. Okay, so this Westphalianism is a crisis because it is no longer efficient in handling the emerging and reimagined issues of our time. Okay, so states are still dominant actors. Don't get me wrong; they are not losing power, but they're sharing power now with a whole lot of other actors. They are not the exclusive actors in international relations and global health diplomacy. So they're sharing space in that Australian system with other actors and international organizations. So there's now two major types of actors. The one that is strictly intergovernmental, which is still taking care of what states do among themselves, governments, doing business among themselves within the UN and outside the UN, and the non-governmental, which doesn't just relate to civil society and NGOs, but this a whole host of actors who are also now interacting in very complex ways, with their states. And this is why, two scholars, Zaka and Keith, argue that contemporary global health governance is complicated and messy. And I agree. I totally agree with them. It's very complicated. There's no one model to study global health diplomacy now. Okay, global health governance. It's comprised of numerous and varied actors with competing values, interests, and motivations. I gave an example of Pfizer. Okay, if you want to do public-private partnership and you say, well, pharmaceutical companies are very important actors, and you bring them to the table. Their interests may not align with the interests of countries, of nation states. So that's the way to look at it, in terms of this new emerging architecture of global health governance. Again, there's another scholar, Findler, who also has argued that this is as a result, this shift we are seeing is as a result of the forces of globalization. And he talks about the fact that we now have international governance, which is intergovernmental cooperation, and he calls global governance the interaction between states, international organizations, and non-state actors. Okay? So, in terms of trying to construct the way forward, there is a book I read long ago, and on a hint of history, the mutual vulnerability of North and South, and it made a lot of impression. And so recently, in the context of COVID and all of this, I'm going to read that book again. And I think we should, and this is something that all of us, should revisit. So the idea of mutual vulnerability, that you are mutually vulnerable, okay, to not just in the health context about pandemics and all of that, but also climate change and some of these emerging global issues. So the accumulation of all the threats close to humans, like disease, pathogenic microbes, in an interdependent world, and the likelihood that humans are going to succumb, to these threats. And this has raised, as I argued, when I was, a few minutes ago, the traditional distinction between national and international health threats is no longer, an easy decision to make. Okay, so where do you draw the line? Because of the porosity of geopolitical boundaries. Now, the key question: what should now guide the foreign policy of countries? We know that the traditional schools of international relations is always about hardcore security, okay, wars, threat of wars, invasion, aggression, use of nuclear weapons. These are the real, security threats. Okay, when the states, this is threatened. The second is commercial interests of countries, trade and commercial interests. This is where, if you talk about these two things, you go to any Ministry of External Affairs, whether it's India, South Africa, the State Department in Washington, D.C., they will listen to you. This is a security issue. These two things. That is, our foreign policy towards China should be driven by, okay, either our economic and commercial interests or security threats or security interests. So where is health? Where is pandemic? Where is climate change? Where is all of this? Okay? So my argument is that we should go back to uniting self-interest. I say this all the time. I've been to different, international, professional forums, and when you say that, it resonates with some people, depending on who you talk to, because they've had, things like a COVID, it was a very good case in point. So enlightened self-interest should drive foreign policy, not just economic and security interests. There's a reason why every country should be very careful about what is happening on, say, health issues, whether it's malaria, whether it's something that you think well, we're not American, so it's not this we don't think about this, because if you don't think about it, it might come back, so the reason why Canada or US, should do something about a health issue in Haiti is not because it's not just about development, but look, if you don't address that, it might actually come back, so that's actually what self-interest, So you do it from a self-interested perspective, and I'd like to get to the end of this by raising some of the quotes that some of the eminent global health scholars have used to portray this enlightened self-interest perspective. Dangers to health anywhere on earth should be dangerous to health everywhere. Yeah, that's come from last. But most Nobel laureate Lenneberg had argued in the work he did around 1994 that the world is just one village, and our tolerance of disease in any part of the world is at our own risk. To basically, fleshing out this, Rothbard has argued that the most important problems facing the human race today are global problems. Okay, what are these? And these are implicated by global interdependence. Okay, so if you have a parochial attitude, if foreign policy is driven by a parochial attitude to world affairs, and we are insensitive to the destruction of the environment, we lack compassion, for fellow human beings who are suffering in different regions, and insufficient imagination to see the danger that lie ahead. This will all condemn the human race to a chaotic and violent future. Okay? Just to tie that to the theme of today's lecture. And I'd like to end by making two provocative conclusions. The first is that we need to go back, I've made this point before, as scholars, to work with the hardcore, those who run the foreign policies in our countries, and the defense policies as well, to create some visibility for health, okay, in diplomacy, in foreign policy, in security studies and practice. Okay. The second is I want to urge some form of transdisciplinarity. Okay, this is not something that international lawyers or international relations or international studies experts or public health. We need to first forge an alliance between scholars and practitioners across disciplines, if we can get this right, for us to get this right. So I would argue for a transdisciplinary approach, that will bring together, the defense and security scholars and practitioners, foreign policy, health scholars, practitioners, and policy interpreters, in order to begin to rethink, the linkages between global health and international security. I would want to end here, and then take some questions and comments. Again, thank you very much for this opportunity.
Thank you, Dr. Aginam, for enlightening us on public health issues, the globalization of public health and its implications for international peace and security. Few questions that you said, if you have any comments or questions, first round. Yeah, please.
Thank you, sir. At the outset, I would like to mention that I took the course on social emotional learning, youth, age, and peace, which was really an enriching experience. Again, to all others, it's a course by MGIEP, and I recommend everyone taking it. So, even though the course was very enriching and preparing us youths to deal with conflictual situations. In terms of human health and in general the conflicts which occurred, I have come across this general trend that humanity tend to forget the perils it goes through, and we came up with hum, uh, human security in 90s, and now we are back to state-led sovereignty, territorial issues on that with the Russia-Ukraine war going on, and then pandemic. Pandemic happened. We all realized the importance of health, but then again that is receding into the background. So with social emotional learning in perspective and this noticing this trend, how can we bring the human consciousness to this aspect also, that we remember and take the values from the suffering that we have gone through and our ancestors have gone
Okay. Yes. Yeah, let's take some more questions.
Thank you, sir, for your enlightened lecture. So let me keep the question to brief. Can you just theoretically expand your idea of enlightened self-interest? Thank you.
Of what? Sorry.
Enlightened self-interest.
Okay.
Can you theoretically, expand your idea on that? Thank you.
Thank you, sir. I'm also a scholar of health, global health governance, and my research work was also related with that global health governance and healthcare systems in comparative way. So here my question is, since these infectious disease and these viruses do not respect the national borders, and also the globalized form of public health in this arena. But here, also in this arena, globalized public health arena, this international and multilateral institution played a very vital role, just like UNESCO and WHO. But now the Trump administration withdrawal its support from which is a major contributor in WHO. So how can we look into this, just like what will be the long-term implications for it, just like means just its political disintegration from WHO? Will it lead to some fragmented global health governance or some regionalized global health governance, which we considered it as a globalized health governance?
Okay. Yes, I think I can respond to those. That are very, otherwise I miss. Okay. The first question is explain the importance on social and emotional learning. How can we use our memories, lessons learned, if I got you correctly. Yes, I agree with you that we have short memory. Okay, it's not just about the international system, but also within countries. We tend to forget. Even in the political arena, something happens, and then the next 3 or 4 or 5 years, we move on, and it happens again, and so we seem not to have learned anything from any lessons from past events. Yes, the point, I'm happy that you brought in this, the social emotional learning part of it, because I work for UNESCO, and my institute, the Mahatma Gandhi Institute of Education for Peace and Sustainable Development, has designed these courses to help in the education systems of countries. So that's really the way to go. Okay. There's no one way I had the same question. For instance, when after COVID, people were kind of saying, the world has learned so much, about this. I served on the WHO expert commission that was put together by the Director General of WHO to review the international health regulations based on, lessons from COVID. So the 194 member states made propositions on how to amend this, and we were delivered for 6 months on this assignment, and you can imagine sometimes late nights with ambassadors and diplomats from 104 countries, it's so difficult to get something done. Okay, we had a tight deadline, and everybody was still stressed to go my own way. America has their own proposal, Canada has their own proposal, Brazil, African states, and then so it's a very intense negotiation, and that's really the kind of frustration that you get in the international system. But that's one way of looking at it, that it is so difficult in the multilateral system to get over 190 countries to agree on one thing, on one way of doing things. We have to live with that, it's everybody's headache. But the good thing that, I like, the way you brought in social and emotional learning. These are things that people don't actually see most times. It's happening, UNESCO, using the soft power of education, because sometimes education is not contested. Okay? It's not like, it's not so everybody wants, there is any prime minister anywhere in the world, or any president who don't want his population educated. So through education, you can actually do a lot of things. Okay? And that's actually where, the work of things like social and emotional learning, will come in. It teaches the skills of compassion, it teaches the skills of empathy, mindfulness, critical thinking, all of these things. And countries are actually, some countries are doing that route. It doesn't have to be SEL. The UNESCO has recently, the executive board adopted a new flagship on education for peace, for instance. And if you look at one of the paragraphs there, it talks about, the mentions social and emotional learning, but talks about art education, talks about human rights education, talks about, violent extremism, all of these things. So these are the different pathways. So I agree with you that countries need to invest more on these kinds of, and I like your call. For anybody who hasn't taken a course on SEL, please go to our website. You can do it at your own pace. Okay? If you get tired, you stop, you can come back and log in again. By the time you get to the end, you get a certificate. It's free of charge. Okay? On the MGIEP website. The second question about enlightening self-interest. Yes, this is something, that whenever you mention that, the foreign policy officials, those who run Indian foreign policy, or those who run the US foreign policy, the State Department, or those who run Canadian foreign policy, they look at you and say, so what do you really mean? Okay? From a political perspective, if you look at the realist school of international relations, it's about, these, strategic interests, which is either security interest, commercial or trade interest. It's liberalism, the liberal school of international relations, that actually comes a bit close, to enlightening self-interest. The realists will tell you that the reason why the the US is a member of the United Nations is to use the UN to maximize its interests. Okay, that's why we're there. That's the major reason why we have to use the international system to protect our our interests, so economic and security interests. But the liberal theory, okay, of international relations basically talks about mutual interests. Okay, that's the reason why you do development funding, for instance. There's a reason why you want to help poor populations, say in Bangladesh or in Yemen or in Haiti or in all these places. Okay, so so you do that not as a handout, okay, not as a peanut, you hand over peanut to hungry people. We are doing this because of the common humanity. Okay, that's the reason why countries would want to join international organizations, because of this mutuality of interest, or do things bilaterally. We want to give them taxpayers' money, public funds, going to fund a non-political thing like education, for instance, in Uganda or in Myanmar. So these are the ways. So united self-interest is putting yourself, you are doing that, but you're also trying to do that from, you're preventing self-harm. Okay? So it's something that resonates more with the liberal, theory of international relations, not very much with the realist theory of international relations. Okay? So the long-term implications of the Trump I hope I'm not speaking for the American government, but the thing is this, let's focus on the WHO. Okay, they've withdrawn from WHO. This is not the first time the US is withdrawing from international organizations. They withdrew from UNESCO some years ago, the first Trump administration. Biden brought them back to UNESCO, I think last year or 2 years ago. Trump gave notice of withdrawal from WHO the first time, but he couldn't. It takes 12 months to fully withdraw when you give notice. But before that, Biden came back and cancelled it, and so there is back and forth game going on. In terms of long-term implications, yes, because these organizations are funded by annual contributions. US has been the biggest economy in the world, is the biggest funders of WHO through its annual contribution. So WHO has to now look at where to get that, that funding gap. There have been some proposals on the table. Some European countries are saying no, they are willing to pay more to cover that. This is a proposal that came at the executive board of WHO, I think in February. Some countries are, lining up, China, to do more, to focus more on specific health issues. So it is difficult to say, how quickly it will go. But the only thing that everybody knows is that it's going to lead to, downscaling of some programs, some global health programs. So that's the reality of the world that we live in, and a country has absolute powers and discretion to withdraw from any organization. So what Trump has done, by withdrawing from the WHO is absolutely within his powers, the US. But is it in the best interest of the US? My personal view is no. I think there is a reason why countries join these organizations, despite the fact that we are all frustrated somehow about the United Nations, okay? Especially the wars, Ukraine, Middle East, Sudan, Yemen, all of these crises everywhere. So we're it's increasing. The Secretary General of the UN has spoken out, about this. That often the Security Council is broken, it's fragmented, it's not dysfunctional. But that's the word of 1945 when the UN was established, But that doesn't mean that because of these frustrations about these wars lasting longer than expected, that there are not good things happening. Okay? As these wars are going on, there are health officials from WHO who are pleading, please pause the bombs. Let's go and attend to those who are sick, who are in hospital. There are people from World Food Program who are there, to give food, to women and children, who are trapped, in these situations. So these are the various ways. So the humanitarian work of the UN, is going on. Those are non-political issues. On the political side, because of these health security issues, we are all frustrated.
So I just wanted to add to the previous question only, in which like we have seen, the world has seen the pandemic of COVID-19, and as it gets repeated and the history keeps on repeating itself, so the previous epidemics and pandemics, for example, in the form of bubonic plagues and the numerous things which you have shown in the slides also. So it is now doubted that the world is now in the post-COVID phase, and the next big thing which is expected or it could happen that will be of the upgraded version of the tuberculosis. So do you really think that the institutions, be it at the international level or at the state level, are they really prepared to now go through again to another level of pandemic, which is now going to affect, like it is expected that the tuberculosis in its very more graded version will be more lethal, even more than the COVID-19.
Okay. Yes.
Thanks, sir. Excellent talk. You talked about the COVID epidemic. So, in the post COVID epidemic phase, Indian government came up with One Health approach. So when you talk about globalization of health, are you on the same page as the One Health approach postulates? So in One Health approach, I think there is also the incorporation of the lifestyle choices. So it's more responsive than reactive. Related to it is emergence of new disciplines of called health humanities, especially in the West. One of the points on the chart of this discipline, that health humanities, is to make this health prescriptions more workable in societies where there is resistance to scientific ideas. But that is where the politics comes in. So if one has to flag the problematics of the health humanities, especially in countries which are radical interested in its political ecosystem. So there, how much do you think the dimensions should be made so that it doesn't impact the health choices made by women and children? Thank you.
Yes.
One more question?
I can answer.
Yeah.
It's not a question, just to compliment you on your terrific presentation. Just because I am currently supervising a doctoral thesis, he's working on public health policy and practices in Canada. And then I realized that there are conflict of interests. So the intersectoral approach that we look at, the Canadian government is trying to bring in some IPR related legislations, and the pharma companies are the ones who are actually opposing it. And if you look at the world also, so something like which are very tropical diseases like influenza or cholera, which doesn't affect the Western world really, those temperate, well-placed countries. So they don't bother that much, but it was only COVID which brought them into action. So that also becomes problematic in terms of it weakens the entire process of diplomacy and also brings in a north-south divide in that sector.
Yeah, thank you very much for raising those two excellent points. Nobody pretends that diplomacy, global health diplomacy is easy. And that's the essence of all of this. It's something that has occupied the time and efforts of so many scholars in recent times. So the point you raised about the IP, the private sector interest on intellectual property, I think is very well noted. And when I was talking about the public-private partnerships and the multi-centric nation of governance, the fact that the interests of the public sector and the private sector don't always align. That's exactly the point. Because at every point in time, you look at it, whether even on something that is so detrimental to health, like tobacco, okay? You want to regulate tobacco advertising and all of that, you see a lobby by tobacco companies. And they do it in such a very, very, very penetrative way that they have a lot of resources. They can tie the hands of governments. So a minister of health, who sees the long-term implications of smoking, for instance, and everyone knows, there's no prime minister anywhere in the world or president who will say, "Oh, tobacco doesn't cause a health issue," but they finance part of it in the case of tobacco. Even countries like Japan, I was at UN in Japan for 6 years, and we find that the tobacco industry, the Japanese government makes a lot of money. Yeah? And that they have shares, their own shares in Japan tobacco company. So they look at it from that economic perspective, the money from sales. And the thing about non-communicable diseases is that these are life costs. It takes a long time before So I agree. I mean, there could be those. There's always that privacy rights and IPs at the intellectual property rights. So thank you for bringing that up. The issue of One Health approach, excellent point. Okay, the interaction between environment, health, and and humanity. That's what it is. Okay, and I think I mentioned the fact that a lot of these diseases are related in the because of the interaction of humans and the wildlife habitats. In whether it's the case of Ebola. So the One Health movement has really gained a lot of traction, in a global health diplomacy. So much so now that WHO, FAO, and the UN Environment Program are working very closely, on that, sharing expertise, and that's encouraging to see, because one thing that if you study international institutions, when these mandates and visions of each of these organizations, and they work in silos, so WHO says, look, we're health, FAO says we're agriculture and food, UN Environment Program, and so things don't actually, problems don't get solved. But when they bring their expertise together on these kinds of issues, and the One Health approach also, what actually galvanized that, that movement is antimicrobial resistance. Okay, our colleague talked about tuberculosis. The fact that we're going to have a much more virulent strain of tuberculosis that may defy existing medications. And this is actually the problem when we were having the issue of vaccine deployment, vaccine apartheid, or vaccine nationalism, or vaccine protectionism during COVID. The fact that, despite the controversies about the COVID vaccines, okay, but those vaccines that were approved by countries that were being used, if there's a mutation, okay, it happened with Omicron, for instance. There was a mutation that rendered those vaccines ineffective. We're back to square one. Okay? So the reason why we shouldn't have vaccines, because a lot of things happen where some Western countries were having vaccines because they want to vaccinate their populations, 3 or 4 times to get the so-called herd immunity. And because of that, there were shortages, in different, developing countries, regions where, the need was the greatest. So what happens when you have a scenario like that? You're having vaccines, available vaccines, and there is now a mutation of the virus, say, in African country where they don't have access to, even the effectiveness of those vaccines. It will come back to the West, and it goes back to square one. So that's the fear, about antimicrobial resistance of, available medicine. That takes me to the first question about tuberculosis. So this idea of emerging and re-emerging diseases, I think that's why I wanted to flag it up. Yes, for things like COVID, it's brand new. Yeah, it's happened. Nobody knew what it was. It took time before scientific community, the biomedical communities to come up with with their vaccine. So there's a sense of complacency that we've conquered tuberculosis. Okay, we have vaccination for it. But what is happening now is that if you mutate and there's a new strain, you go back to square one because all those available drugs will not become ineffective. So all of these things are all interlinked, and that's why if you look at things from the perspective of there's a way we can actually get foreign policy officials or even as scholars begin to think about it from a security perspective. It makes much more sense as opposed to this is a health issue. Health is actually something that is very low in the estimation of security threats, in the estimation of the policy and the security communities. So this is food for thought. Whether you're a practitioner, whether you're a scholar, whether you are an analyst, policy analyst, there's work for us to do, depending on whichever way you look at it, in order to move towards a much more holistic, global health security.
This is the last round. Anybody has any comments or any question?
Maybe I can
Yeah, please.
I'll add one question.
Okay.
You'll add a question. I'm sorry. Just a very, very brief comment really because she was talking about the transnationalization of health services. There's so many ethical dilemmas that are involved. I mean, for example, a project that was talking about patents and, highly priced drugs coming. But then there was also, for example, Cuba. And with a long history of providing healthcare professionals. And now that also is under question. So I just thought I would make a brief comment about that. And also other kinds of ethical dilemmas like migration of health professionals from the less developed, the developing countries to the more developed countries. And you can't really stop that either.
Yes.
So it's a dilemma. Anyway, thank you. I really enjoyed your presentation.
Yeah, my question is that might be few of are aware and few are not aware. Like OBI has been very active and very actively participating in basically different multilateral platforms on health issues for a longer period actually. So my question is very much associated with that. Like we have many countries which are not so much happy with this present status of regulations, particularly IHR 2005 revised. Basically. Thereafter, many countries are raising wide for reform within that larger framework of IHR architecture or basically the provisions of IHR. Basically. So, what kind of changes we may expect in the days to come? Because the voices are coming from countries, especially from rural south.
Yes. Well, those questions, they're not protests. It's just more of frustration because they thought the IHR would go, further than, what we have now, the revised text. And this was what I was trying to refer to, when I was serving on the DG's experts advisory committee on the revision of the IHR. We received about 280 proposals from different countries on different aspects of IHR. And the first thing we did was look, IHR actually is, if you look at it, is something that actually talks about the kind of measures that countries should take, when there's an outbreak, in order to maintain a balance between movement of people across boundaries and, in a way that doesn't impact international trade. So it tries to put a balance, in that. Because what normally happens before is that, okay, something like an outbreak of cholera has happened in Peru, okay? The US, European Union, will embargo every single good coming from there. People coming from Peru, even if, they're not, so they're all subject to quarantine and all of that. So there was chaos everywhere. So IHR seeks to maintain a balance between, international movement of people and in a way that doesn't really, jeopardize, trade and all of that. So to avoid excessive measures, okay? So there are measures you can take. The country can require vaccination certificates, things like that. So whenever an pandemic is declared, the IHR empowers the EG of the World Health Organization to seek scientific advice from a group and then to say, okay, well, these are the measures we can take. Okay, in practice, countries do what they want. They don't listen to those, there's excessive, practices, border practices, detention of people, quarantine, testing, all of these things, okay, beyond the IHR measures. Now, what the developing countries were quarreling with is that they made a lot of recommendations because of the lack of access to vaccine. And they said, they call themselves the human rights group, the African group were saying, look, we have the rights to, to vaccine. Okay, forget about the controversy of vaccines, but they made what they call the medical countermeasures. PPEs, oxygen, all of these things, they're all, necessary. So vaccine is just one part of, this. Yeah. So they never had access to all of this because think about the poorest countries. So they say this is not equitable. We have to, there's right to health. So that kind of, position. So our work, the first time we were in Geneva for this, the 9 of us, we sat down with the DG of WHO, and what we told him was that some of these things, yes, from an equity perspective, we see where they're coming from. It was based on the experiences they had during COVID. But this is not actually an IHR issue. So why don't we? There's another parallel process, the pandemic treaty, okay, which was now supposed to take care of all of this. So these things belong to the pandemic treaty. It was a parallel process. So let's keep the IHR the way it is, expand it, try to keep it to the original mission of maintaining international travel without jeopardizing trade. But all of these broader issues about right to health, about technology transfer, some of them were pushing for technology transfer. So those kind of things they should be in the IHR, the pandemic treaty. So that was how the IHR ended up being, what we have now in the revised draft. But one thing that actually we wanted to see a change about was the fact that, in the past, the DG of WHO would sit back, that something has happened, he wouldn't do anything, he was waiting for countries to report, to do anything. But he should be active, okay? Which actually is the reason why Trump, is mad with WHO, because he said WHO deferred too much to China during the election. Because the WHO director there sat and until things got out of hand. So, and this is a big country. I mean, this is China. It's not China. So you have to really use a delicate balance. So yes, he had the power to say, we hear that something is happening in Wuhan. Okay, and you have to open up for our listen to go in. He didn't do it. Okay, so that was actually part of the reason. So right now, it's clear in the IHR that the DG can make use of information, medical information, to approach a country and say, we have this evidence, and then try to listen. So again, let's see how when something else happens. So, but some of these other issues, technology transfer, the right to health, all of this, will now reach the pandemic treaty, and it's about to be concluded. It was supposed to conclude it in May last year. So they're getting to the last bit of it. So anytime from now, there'll be, the WHO pandemic treaty. Yeah. The one last point, just to add to the point that you made about migration of health professionals, because it's something that is extremely important. This is something that if you are a poor country, say in Africa, okay, there's a public university. Let me put it in a scenario that will make a lot of sense. At the public university, you spend time training doctors, okay? There's no tuition, and you put in a lot of resources. You can't. The doctor has qualified as a doctor. He's working in a government hospital, and then the next year, the next 2 years, 3 years, he wants to go to Europe. He wants to go to so people have the right to move, okay, to leave a country. But what happened in the 90s, late 80s and 90s, was a deliberate attempt by UK, by the US, by Australia, by so many countries, they devised visa schemes, okay, to actively recruit, these doctors and nurses from these countries. So it's no longer a voluntary migration, okay, in order to make up for the shortfalls in their countries. So that's where the issue is, So it's poaching. Some people call it poaching. You are poaching the health professionals, offering them, luring them, creating those visa schemes, and that's why WHO had the International Declaration on Migration of Health Professionals, trying to say, look, don't do this. If somebody voluntarily wants to leave, that's fine, but stop recruiting, stop poaching them. Because they go in, and for instance, some of the nurses and doctors in the UK, they come in and then they start practicing, in order to address that. So there's a very interesting, for some of you who are interested in this, there's a very interesting study that showed that in the city of Manchester alone, Manchester, that's one city in England, there are more Zambian doctors trained at the University of Zambia in Manchester than the whole of Zambia. Yeah. There are more Malawian doctors in Birmingham, city of Birmingham, in England than all doctors in Malawi. And these were products of University of Zambia, University of Malawi, trained by public funds, and they find themselves in the. So it's, you can imagine, what they so you train them, they go through medical training is quite long and expensive, and reference and everything. So they finish, and then the next 3, 4, 5 years, there's a scheme that takes them to the UK, and it's not all over again. So that's the spiral that's.
Thank you, Dr. Aginam. Only enough vote of thanks. I will request Dr.
On behalf of the School of International Studies, I am pleased to express my deep appreciation for Dr. Obijiofor Aginam. The essence of your lecture or talk was summed up in the quote by Hans Zelser. Soldiers have rarely won wars, microbes have. So that sums it all. We don't need, and especially located in SIS. It's very interesting because SIS is known for its interdisciplinary research, and the way you connected globalization, public health, peace, security is truly unique. And the gamut of issues that you covered, our research scholars will definitely gain from your discourse today. I value the presence of the esteemed guests, especially from your university, my faculty colleagues, and the students. The remarkable support from Professor Mattu, who's not here today, but he's been the driving force behind these lectures, and a team of dedicated colleagues led by Professor Preeti, exceptional group of student volunteers who work tirelessly to tie all the loose ends and ensure that there is flawless execution. Dr. Shakti for his unwavering support in terms of live streaming the event always. And this series, so far as Preeti pointed out, has been able to bring brilliant minds that have given distinctive and novel perspective on international studies. We look forward to getting together shortly for another lecture. Thank you.
Thank you very much. I just